Pertussis, also known as whooping cough, is a highly contagious respiratory disease caused by the bacterium Bordetella pertussis. It was first discovered in 1906 by Belgian bacteriologist Jules Bordet and his brother-in-law Octave Gengot. They were able to isolate the bacterium responsible for the disease, which led to a better understanding of its transmission and symptoms, as well as the development of diagnostic tests and vaccines to combat the illness. Whooping cough, or pertussis, is primarily transmitted from person to person through respiratory droplets. The infection spreads when an infected individual coughs, sneezes, or talks, releasing droplets containing the Bordetella pertussis bacteria into the air. These droplets can be inhaled by people nearby, leading to the spread of the infection. The disease is highly contagious, especially during the initial stages, when symptoms resemble those of a common cold. Infected individuals are most contagious during the first 2 weeks of the illness. As the disease progresses, the characteristic whooping sound may develop during coughing fits, but the contagiousness usually decreases at this stage. To reduce the risk of transmission, it is essential to practice good respiratory hygiene, such as covering the mouth and nose when coughing or sneezing, washing hands frequently, and avoiding close contact with infected individuals. Vaccination is also a critical preventive measure against pertussis, with the DTaP vaccine for children and the Tdap booster for adolescents and adults providing protection against the disease. Pertussis, or whooping cough, has a range of symptoms that usually develop in stages. The incubation period for pertussis is typically 7 to 10 days but can range from 4 to 21 days. The symptoms are often divided into 3 stages: the catarrhal stage, the paroxysmal stage, and the convalescent stage. Catarrhal stage, 1 to 2 weeks. This stage is characterized by symptoms similar to those of a common cold, including mild cough, runny nose, low-grade fever, sneezing, watery eyes, general malaise. Paroxysmal stage, 2 to 6 weeks. As the disease progresses, symptoms become more severe and distinctive, including severe, uncontrollable coughing fits, often followed by a high-pitched whoop sound during inhalation, difficulty breathing, gasping for air, vomiting or gagging after coughing fits, fatigue and exhaustion due to coughing, cyanosis, bluish discoloration of the skin, in severe cases, caused by lack of oxygen during coughing fits. Convalescent stage, 2 to 6 weeks. During this stage, the frequency and severity of coughing fits gradually decrease, but the patient may still experience coughing episodes triggered by respiratory irritants or physical activity. The risk of complications and the contagiousness of the disease also decrease during this stage. Infants, especially those younger than 6 months, may not exhibit the characteristic whoop sound but may instead experience episodes of apnea, temporary cessation of breathing. In some cases, pertussis can lead to severe complications or even death, especially in young infants, older adults, or individuals with weakened immune systems. Treatment for whooping cough, or pertussis, typically involves a combination of medications and supportive care. The primary goals of treatment are to manage symptoms, prevent complications, and limit the spread of the infection. Antibiotics. Early administration of antibiotics can help reduce the severity and duration of the illness, as well as decrease the contagiousness of the infected individual. The most commonly prescribed antibiotics for pertussis are macrolides, such as azithromycin, erythromycin, or clarithromycin. In some cases, especially for infants and pregnant women, alternative antibiotics like trimethoprim sulfamethoxazole may be used. Supportive care. Managing symptoms and providing supportive care are essential for patient comfort and recovery. Supportive care measures may include hydration. Encourage the intake of fluids to prevent dehydration, especially in cases where vomiting occurs after coughing fits. Rest. Ensure adequate rest to help the body recover. Humidifier. Using a cool mist humidifier can help soothe the airways and alleviate coughing. Cough suppressants. Over-the-counter cough suppressants are generally not recommended for pertussis, as they may interfere with the body's ability to clear mucus. However, in some cases, a healthcare provider may recommend a cough suppressant for short-term relief. Monitoring and follow-up. Patients, especially infants and those with severe symptoms or complications, should be closely monitored by healthcare providers. Regular follow-ups may be necessary to assess recovery and ensure proper treatment. It is important to note that early diagnosis and treatment are crucial for reducing the severity of the infection and preventing complications. Vaccination remains the best preventive measure against pertussis, with the DTaP vaccine for children and the Tdap booster for adolescents and adults providing protection against the disease.